Okay, we're here with Dr. Bidkaram. Dr. Bidkaram, can you tell us more about shockwave therapy?
So extracorporeal shockwave therapy, actually, it's been a technology that's been around for about 40, 50 years. It's, for lack of a better term, it's ultrasound on steroids. You have pure sound pulses that are directed to a certain depth for treatment of different conditions. Things like tennis elbow, plantar fasciitis, trochanteric bursitis, different musculoskeletal conditions.
And what's the physics behind it? How does it achieve, what does it do mechanically to the body to achieve its pain relief?
So, as you know, most of the musculoskeletal conditions, there's some common denominators as far as problems with them. One is the scar tissue that forms. When you get injured, your body, the first thing that it does, it creates scar tissue, it creates inflammation. If it's in the spine region, it creates muscle spasming. Unfortunately, that stays on for years after year, and a lot of times nothing has been done properly to break up that scar tissue. And scar tissue, one of the main problems with it, besides having a real bad matrix, being less vascular, it has more pain receptors than normal tissue. So the areas that we injured, for example, shoulder, elbow, feet, low back, what have you, they develop what we call trigger points. These are the areas that have higher scar tissue, and the higher scar tissue has more pain receptors. So we always have not only weakness with that area, but problems with them. They reoccur all the time because that scar tissue has not been addressed properly or broken up. So extracorporeal shockwave therapy, we're able to go in there, determine, let's say for example, if it's a tennis elbow where you injure that joint, what the machine has given us, or the technology has given us the ability to do, is to go in there, figure out how deep we need to go to access where the tendon attaches to the bone. And via the sound pulses that the machine generates, we could break up the scar tissue that forms in that area. So there's several things that happens. Not only we're breaking up the scar tissue, so we're eliminating that, the more of the pain receptors, what's referred to as nociception. We're also getting rid of the chronic inflammation that that exists there. We're also modulating or getting rid of or reducing the substance B production, which leads to pain formation, and restoring or creating more vascularity to the area, which leads to faster healing.
Right, and scar tissue is different from regular ligament tissue in
Correct.
that it's less elastic, it's my
Correct.
understanding. So this is why you re-injure the same areas. It's a stress point, and it's going to give.
Correct.
Typically. So basically the shock wave kind of breaks down that abnormal matrix.
It does.
And then does new tissue grow in there? Or?
Yeah, your body has anytime that you have an injury, first of all, normal tissue, it's more linear in pattern. Scar tissue, it's like a blob. Think about a hairball, because your brain is trying to heal that area as quickly as possible. So it infuses the injured area with a lot of that scar tissue, and also it doesn't get enough time to have enough vascularity go into that area. So it's weaker, and that's why we always have problems existing if it's not taken care of properly. So what I do, I utilize the shockwave therapy to break up that chronic scar tissue formation, and via specific chiropractic adjusting, realign that area, whether it be in a extremity joint or spine, and allow your brain to lay down new scar tissue that emulates normal tissue as much as possible, more linear in fashion and stronger.
I see. So that's where the rehab comes in.
Correct.
Okay, good.
Okay.
And does it hurt?
It is uncomfortable a little bit, but the patient's tolerance is what we always ask them to do, to tell us how much they could handle as far as the intensity that we use, because you could change the frequency, the intensity, the depth of penetration by changing the headpieces, but also the number of pulses. So if somebody could maybe handle a 1 or 2, that's all we do. If somebody could handle a little bit higher intensity, that's also what we do. But as the treatment begins and commences, because we're breaking up the scar tissue, the patient's tolerance also goes up, because now they don't have as much pain receptors that we have to deal with. So they could handle more of an intensity as far as the pulses are concerned.
Makes sense.
Yeah.
And I guess the longer an injury has been chronic, there's probably more scar tissue, so you would
Absolutely.
probably want to go with a higher intensity, right?
Initially, no. We want to make sure, because the way the protocol that I developed is I determine how deep I need to go to get to the, basically what we call the periosteum, which is the sheath that covers the bone. And I work backwards. So let's say it's the maximum depth we need to get is 25 millimeters. These headpieces are in 5 millimeter increments. I start at about 15, I do 2 at 15, 2 at 20, and then the last 3 are done at 25 millimeters. Sometimes the patient needs more than 7 treatments, maybe up to 10. So we kind of manage that, but as we start shallow, we slowly start building up on not only breaking up different layers of scar tissue, but also the intensity of the treatment goes up, but the patient doesn't perceive it as much.
Well, that's awesome, because my understanding is that there aren't many modalities that can go 25 millimeters.
Well, with this one, we could actually go to 30 millimeters.
Yeah. So a lot of people don't know, when you put a hot pack on your skin, it's pretty much superficial.
Sure.
It doesn't get down to, like, let's say you have a deep joint like a hip.
Mm-hmm.
The acetabulum is, how many millimeters is that? So.
Well, depending on the patient also, I mean, this technology has been used by veterinarians for a long time, and they have access to applicators that go as deep as 40, maybe 50 millimeters.
Wow.
To treat horses and what have you.
Mm-hmm. Yeah. Great. And where would one go? Is this something that's common in the United States?
So it's actually extremely common in Europe and Asia. They've been utilizing it for a long time. All the pro sports teams, especially soccer teams in Europe, they use it. That's as a normal protocol. I worked with San Jose Earthquakes here locally. Some of their players were European, and after they had been injured, they requested European protocol for their rehab. And they had provided all the rehab things, but there was one thing that was missing, was the shockwave therapy. That it's a normal process for rehab protocol that they have. Teams like Barcelona, Real Madrid, and all of them. And the strength and conditioning coach is one of my patients and a friend of mine, and he had referred the patients over to add this to the rehab protocol. But as far as in the United States, it started in back east and basically making its way into western United States, West Coast. Southern California beginning, and my colleague and I were the first ones to kind of bring it up to Northern California about 10 years ago. And we've been doing it longer than that.
Mm-hmm. And just so you give a good analogy of this, did you say it's related to the machines that got rid of kidney stones? It's
Yeah.
the same kind of technology, basically?
It is the same technology. Lithotripsy is a class 2 modalities that it could only be used by medical doctors, urologists, to break up kidney stones. This is a FDA-approved class 1 modality in the same category as ultrasound, TENS unit, muscle stem, Russian stem, all of those.
I see.
So it is within our scope of practice as chiropractors to be using it. Also, the technology, this particular unit, and with the headpieces, can also be used in the shockwave therapy for conditions like erectile dysfunction, for non-union fractures, which those two conditions are out of our scope. So if we want to be able to work with those patients, we have to work with medical doctors under medical supervision and with their medical licensing.
I see. How about someone who's post-surgery?
Yes.
Would that be, and how long after the surgery? Like let's say you had knee surgery and you want to prevent that scar tissue from building up? How
Well, as you know, with the knee replacements, they get them on movement and rehabbing immediately. One thing that we have to, it's contraindicated with this unit, again, going back to how they found out about it, because we can't be utilizing it right at the replaced parts. Basically because of the sound waves, it jars the knee replaced areas or shoulders or what have you loose. So we have to avoid anything that's artificial as far as metal or plastics within that area. But utilization of it, I've done pre-surgical, post-surgical, as soon as possible, because you want to get maximum amount of improvement in as soon as possible prior to scar tissue forming. So
great.
Yeah.
Could you maybe explain some of the cases you've had that
Sure.
have been successful?
As far as when you're looking at the RCTs, as far as the randomized controlled trial studies that you look at across the board with Shockwave and the technology, they show about 70 to 80% very positive results with conditions that it's used for. In my clinic and also my colleagues' clinic, I could easily tell you it's been above 90%.
Wow.
Things like carpal tunnel syndrome, which is very common, as you know, but some of the conditions that I've used this quite a bit are plantar fasciitis, tennis elbow, calcific tendonitis, calcifications in the shoulder, literally breaks up calcium
Frozen
deposits. Frozen shoulders takes a little while. I used to do manipulation under anesthesia, which was a little bit faster, depending on how chronic that is, but it takes more treatments for a frozen shoulder, and it has to be really combined with proper rehabbing as far as getting in there with the exercising. But again, plantar fasciitis, calcification, which is one of the big things, tennis elbow, golfer's elbow, jumper's knee, trochanteric bursitis, a lot of different cases.
How about TMJ?
TMJ you can, especially if you have inflammation, but you have to use a very shallow and very minimal amount of pulses and intensity just to be basically to work the temporomandibular joint area. But deep retains contractures where patient's fingers are stuck, you could use it for that. Anything that you're dealing with fibrosis, adhesions, or scar tissue formation, which almost is everything in musculoskeletals.
Okay, it sounds like an amazing machine.
It is.
I think if you have any kind of chronic joint issue, especially if you've lost some flexibility in it, and you've tried everything else, then Shockwave seems like it's the next logical step. Right?
It is.
If you have it available.
It is, and the one thing is, most of us chiropractors that we always deal with musculoskeletal conditions, one of the things that we always face is, unfortunately, most folks come to see us as a last resort. So when they come in as a last resort when they've been injured, was one of the things that we always face. It's chronicity of the condition, scar tissue formation, muscle spasming, inflammation, all those things. And that's where this comes in to be able to address that. So now we could properly restructure the areas that have been injured.
Nice. So do we have a patient that we could
yeah, we have a
some?
patient that I have asked my assistant to join us, and she has a little bit of a tennis elbow stuff that we're going to demonstrate the machine on.
Okay, great. Let's do that next.
Sounds great. Thank you very much.
Sure.